Personal hygiene and care can make an enormous difference in the way we feel about ourselves. Just the simple act of brushing our teeth makes us feel so much more refreshed after a long night's rest. Hi, I'm Kathy Getrist, and today we're going to be talking about personal hygiene. The personal care measures that we're going to be focusing on today will include brushing the teeth and dentures, nail care, as well as perineal care. Personal hygiene refers to cleanliness and health of the body. Personal care and hygiene measures are included in activities of daily living, frequently just called ADLs. And it's those activities that are done every day for most people. Assisting with personal hygiene measures will be one of the main responsibilities for you, the caregiver. Holistic personal care is the concept of treating the whole person as an individual. Personal care provides for physical needs such as cleanliness and infection control, as well as psychosocial needs. For example, providing perineal care for a resident certainly does help them if they've been incontinent of urine, makes them feel more refreshed, free of odor and skin irritation, but it also helps their self-esteem and their appearance. Personal hygiene practices are influenced by personal preference and vary greatly from individual to individual. I'm sure if I asked each of you who's watching this videotape whether you brush your teeth before breakfast or before meals or after meal, I would get varying answers. Most people hold strong opinions about how, when, and where to perform the personal care activities. And patients have a right to make choices according to preferences, and those choices should be respected and followed whenever possible. Personal hygiene practices are also private activities for most people. For example, taking a bath, brushing teeth, or even applying deodorant are usually done in private. Do all you can to protect privacy. Do not ever unnecessarily expose a person's body during the personal care procedures, and remember to close the door, draw the drapes and privacy screens if they're available when providing care. The first personal hygiene measure we'll talk about is oral hygiene, which is about the care of the mouth and teeth. Proper cleaning of the teeth and mouth helps to prevent tooth decay called dental caries. It also helps eliminate bad breath. Medical term for that is halitosis. Provides an opportunity for inspection to see whether there might be any broken teeth, any irritation of the gums, sores, cracked lips, and it also contributes to physical and emotional comfort. Patients should be encouraged to do as much as possible for themselves. Routine oral hygiene is provided in the morning, before or after meals, and at bedtime. Now I'd like you to watch a demonstration of assisting with oral hygiene. Assemble the equipment on the overbed table and pull the privacy screen. Position the patient at the sink or upright in bed. Place a bath towel over the chest and shoulders. Pour water over the toothbrush and apply paste. Put on your gloves. Assist with brushing as needed. Use up and down motion, the gum surface to the edge of the teeth. Brush the tongue and gum surfaces. Rinse the mouth with water. Place the emesis basin near the chin for return of fluid. Repeat the brushing and rinsing as necessary. Dry the lips with a paper towel, bath towel, or washcloth. Floss the teeth daily. Select a piece of cloth about 12 inches long. Wrap the ends of the dental floss around the middle fingers, leaving the center area free. Gently insert the floss between each tooth. Move the floss from the base of the tooth to the gum line. Rinse the mouth with water. Offer mouthwash. Dilute if desired. Wipe the mouth and chin. Lubricate the lips if desired. Remove the towel and rinse the toothbrush with water. Remove your gloves. Lower the head of the bed and return the equipment to the proper storage area. Mouth care needs to be done more frequently on certain patients to prevent odors, drying of mouth, and accumulation of secretions. Some of these patients may be unconscious, those that are vomiting a lot, experiencing a high temperature, breathing through their mouth or receiving oxygen, and those residents who may be in the dying process. Mouth care should be done at least every 2 hours. Position the individual that may be unconscious or in the process of dying on their side so as not to choke when doing mouth care, also called aspiration. Use commercially prepared touthettes and swabs in place of a toothbrush for these special needs. There are a variety of lubricants that might be used for the lips. You're seeing a variety of them on the screen. Always assume that the patient can hear you and explain the procedures and talk to the individual throughout the cares, even if they give no indication of being able to hear you. Now watch a demonstration of special oral hygiene. Position the patient flat in bed with their head turned to one side. Protect the pillow with a bath towel. Place the emesis basin over the towel to catch secretions. Apply gloves. Clean the mouth using a touthette with diluted mouthwash or other ordered cleaner. Limit excess liquid to prevent choking. Clean the inner surfaces of the mouth, including the gums, teeth, and tongue. Repeat as needed. Discard the used applicator